Headaches, migraines. It seems like something is so common because so many people have them that it becomes to think like it's normal, but it's not. Headaches are not normal. The three things that I really want to talk about how headaches develop and certain things to do in order to correct them. For one, we need to talk about what triggers headaches. Okay? Now, triggers for headaches can be many different things for many different people. One is really alcohol consumption, is going to be dairy intake, chocolates. Those are going to really increase the probability of having headaches for people that are already used to experiencing them. Make sure you stay hydrated, and also relaxation. Okay, stress is such a big part in what's actually going on. When we talk about stress, it's really the muscle tightness, especially here at the base of the skull. Now, whenever tension happens here into the base of the skull, it's going to have such an issue because it is inflamed, and it's going to feel like a pounding motion here into the sides of the temple and into the front of the head. Third, we need to talk about positioning. Okay, when we talk about positioning, we need to look at what normal is supposed to be like first. Now, when we take a look at the neck, what we want to see is that there is a curve this way. Now, textbook normal curve is going to be a 35-degree curve. Now, with that 35-degree curve, it's going to allow pressure from the head and also from gravity on those disc spaces evenly and appropriately, and make sure that there's not pressure on those nerves, which in turn is going to cause those muscles in order to inflame and tighten, which is going to cause more pain and discomfort for you. So, did you know that for every inch that you're forward, it's going to add 10 more pounds of pressure? That's putting more pressure on that curve, which is in turn going to cause more pain and discomfort, which is the chronic problem that a lot of people experience. Now, there are stretches and exercises that we can teach you and we can tell you to do, but also what we need to do is we have to get motion back into these areas. Because if you have a subluxation, which just means pressure on that nerve, that's not allowing your brain to communicate correctly, which is causing pain and discomfort, and it's not moving properly, no matter if we decrease the triggers, no matter if you get massages and you decrease the tension in the muscles, that's not going to get better. So what we really need to do in the first step always is going to be to get motion back into the joints of the spine and of the neck and into that C1 and C2, which are the first and the second bone that come directly off the skull, which is most commonly the cause of headaches and migraines for people. Whenever you're experiencing headaches, you're experiencing migraines, it can be from many, many different things. Now, already what I'm seeing from here, whenever we're evaluating what's going on, there's a lot of tightness into the jaw. So whenever you're clenching your teeth at night, and there's a lot of things. Now, there's multiple muscles that we look at, especially here with the jaw, masseter, the buccinator, and even the pterygoids that are underneath here. Now, those are just fancy name for muscles that we look at whenever we're doing an evaluation based off of what's causing your headaches and what's causing your migraines. Now, already just from palpation, whatever I'm feeling, I can feel that C1 has shifted to this right side, and also C2 has rotated. So what I'm going to do, I'm going to relax the muscle slightly here, let it release a little bit, and then we're going to get pressure off of that area. Good. It doesn't have to be anything extreme. It can be smooth, calm, and easy, because if we move too much at one time, it can have a negative effect because those muscles can really start to spasm. Now, as we've shifted that, there's also rotation here at C4 and C5. So, good. Release the jaw a little bit. Someone clenches at night. Sorry. All right. There we go. Perfect. It's so helpful just to get pressure off of the brainstem. What that's going to allow for is better blood flow into the brain. And also with taking pressure off of that brainstem, it's going to allow the rest of the body in order to communicate better. So with headaches, that is what we check on first the most, increasing range of motion into that area and unlocking those joints.